All right, welcome back to the deep dive. Today we're tackling a topic that's super relevant for all you future doctors out there, especially those gearing up for the MCAT. We're going deep on social class and really trying to understand how this whole concept plays out in healthcare.
Yeah, it's a big one for sure.
So, big question for this deep dive, and I think it's one a lot of pre-med students have. How do social class and socioeconomic status,
Yeah.
like really impact individuals and their health? And why is this so important for aspiring physicians like yourselves to get a handle on?
Because it's not just about textbook knowledge, right? It's about how you approach patient care, how you see the world, really.
Exactly. And for this deep dive, we've gone through a ton of research, like articles on sociology, stuff on health disparities, all that good stuff.
Yeah, trying to distill it down to what's most essential for you all as you prep for the MCAT and as you move into your careers.
Okay, cool. So, first things first. Let's clear up some basic definitions. What exactly is the difference between social class and socioeconomic status? Because I feel like a lot of people use these terms interchangeably, but there's got to be a distinction, right?
Absolutely. There is. It's a really common point of confusion. Think of social class as kind of like a broader label. It's about how people are grouped within society, often based on things like shared economic circumstances, cultural norms, where they stand socially.
Right, so we're talking about those general categories like working class, middle class, upper class.
Exactly. It's a bit more fluid, though. It takes into account social perceptions, how people see themselves and how they see others.
Gotcha. So it's not just about like hard numbers, it's also about the narrative that goes along with those numbers, the whole social context.
Right. And then you have socioeconomic status, or SES, and this is where those hard numbers come in. This is about quantifying someone's position, using specific indicators.
So it's measurable.
Yeah, much more measurable. And the main things we look at here are income, how much education someone has attained, and occupational prestige.
Okay, that makes sense. So SES gives us the data, the income level, the years of schooling, the status of their job, and social classes like the bigger picture.
Yeah.
It's how all those factors play out in a person's life and how it shapes their experiences, their worldview, even their health.
You got it. And that subjective element of social class, those perceptions and shared cultural understandings, that's what really has a huge impact. It affects people's behavior, their expectations in different social settings, and this is crucial for you as future doctors. It really influences the dynamics you'll see in medical interactions. Think about it. A patient from a lower socioeconomic background might have totally different assumptions and experiences in a healthcare setting compared to someone from a higher one.
Absolutely. So it's not just about the resources people have, it's also about their background, how they navigate these different social worlds. Okay, let's do a quick pop quiz to make sure everyone's following along.
Good idea. A little knowledge check never hurts.
All right, which of the following is not typically used to measure socioeconomic status? And here are your options. A, educational level. B, neighborhood crime rate. C, income level. D, occupational prestige. Take a second to think about it. And the answer is B, neighborhood crime rate.
Right. While neighborhood crime rate might be correlated with, areas that have lower SES, it's not a direct measure of an individual's status.
It's more of an environmental factor, right? Something that could be associated with lower SES, but not directly used to calculate it.
Exactly.
Okay, awesome. Let's move on to some of the more, complex ideas within sociology. What exactly is class consciousness? This is a term that I've heard thrown around a lot, and it sounds like it has implications for social change, right?
It definitely does. At its heart, class consciousness is the awareness among members of a certain social class that they share common interests, common goals,
Yeah.
and that their position in society, which is often one of disadvantage, is like something they share with others. And this shared awareness, that can be a really powerful force for change. It can motivate people to challenge inequalities.
So it's like that moment when people realize, hey, we're all in this together, we're facing similar hurdles because of where we stand in society, and maybe we can do something about it collectively.
Yeah, exactly. Now, on the flip side, you have this concept called false consciousness. And this happens when people in a lower social class, they unknowingly adopt the beliefs and the worldview of the dominant class. So they might internalize this idea that the social hierarchy, the way things are, is just like natural and inevitable, even if it's not working in their favor.
False consciousness, it's almost like a mental block that prevents people from seeing their own collective power,
Right.
or the possibility of changing the system.
Yeah, that's a good way to put it. It can definitely obscure the systemic roots of inequality. And this idea ties in with something called social reproduction, which is this tendency for socioeconomic status to be passed down from one generation to the next.
So even though individual people can move up or down the ladder, overall, there's this pattern of kids ending up in a similar socioeconomic position as their parent.
Right. And there are a few things that contribute to this. One of the biggest ones is what we call cultural capital. This is all the non-economic resources that people possess.
So things that aren't money but still give you an advantage.
Exactly. Things like your education, your language skills, your social etiquette, whether you're familiar with dominant cultural norms, all of that. These things might not be financial assets, but they can really make a difference in how you navigate social institutions.
So it's not just about inheriting money, it's also about inheriting the knowledge, the skills, the connections that are valued by society that help you get ahead.
Exactly. And this is where we see the impact on healthcare. Think about it. Kids from higher SES backgrounds, they often have this advantage because they've been exposed to certain ways of communicating, encouraged to pursue specific intellectual interests. They learn to interact in ways that are like privileged by mainstream institutions, and that includes the healthcare system.
Okay, now that you mention it, I can see how this plays out. Can you give us an example of like a real world scenario where cultural capital comes into play in a doctor-patient interaction?
Sure. Imagine a patient who doesn't speak standard English or whose first language isn't English, right? And they're trying to communicate with a doctor who isn't really attuned to those cultural differences in communication. Even if the patient understands their health issues perfectly well, the doctor might misinterpret their communication style as a sign of low health literacy or, like that they aren't that intelligent or something.
Wow, yeah. That's a really powerful example. And it's not even intentional on the doctor's part, right? It's just this unconscious bias based on cultural differences.
Right. And it shows how a patient's cultural capital, or I guess a mismatch with the dominant cultural capital of the healthcare setting, can actually affect the care they receive.
This really underscores why cultural humility is so important for doctors. Being aware of your own biases, being sensitive to these differences, and really making an effort to understand where your patients are coming from. Okay, let's shift gears a bit and talk about power dynamics more broadly. Like, what do we mean by power in a sociological sense?
Well, power in a social context, it's basically the ability to control resources, to influence the actions and beliefs of other people, and to shape the dominant norms and values in society. It's about having agency, the ability to make things happen, or to, maintain the status quo.
Okay, and how does privilege fit into this? How is privilege related to power?
Privilege is, in essence, the unearned advantage that some groups in society have simply because of their social identities. And a lot of times, people who benefit from this privilege aren't even aware of it.
It's just like baked into the system, right? Can you give us an example of privilege, like a really concrete example of how it operates within the healthcare system?
Sure. One very clear example is the difference in treatment that we often see between patients who have, say, really good private insurance versus those who rely on Medicaid or who are uninsured.
Okay, yeah, I can see that.
People with comprehensive private insurance, they typically have much quicker access to specialists. They have a wider range of treatment options available to them, and honestly, they often end up in more comfortable facilities.
So being able to afford that premium coverage gives them this built-in advantage.
Exactly.
Okay, now there's another concept that I think is really essential to understanding social inequality, intersectionality. Can you explain what that's all about?
Of course. Intersectionality, it's a framework that was developed by Kimberly Crenshaw. It basically emphasizes that all of our different social identities like race, gender, socioeconomic status, sexual orientation, they don't exist in isolation. They intersect and interact. And that creates these really unique and often compounded experiences of both privilege and disadvantage.
So it's not just about being discriminated against as a woman or struggling because of low income or facing bias as a person of color. It's about how all those things come together to create a much more complex reality.
Exactly. And this has huge implications for how we understand health disparities.
Yeah.
Let's say you have a Black woman who comes from a low-income background. She's likely facing challenges in accessing quality health care, not just because of her socioeconomic status, but also because of the intersection of racial and gender biases that exist within the medical system. These intersecting disadvantages can really add up and lead to much worse health outcomes for her compared to someone who's not facing those same challenges.
Yeah, it's like this multiplicative effect, right? The disadvantages compound on each other.
Right.
Okay, let's do another quick quiz to, solidify these concepts. Here's the scenario. A wealthy immigrant moves to a new country, and even though they can afford great medical care, they have a lot of trouble navigating the healthcare system. They just don't understand how it works in this new place. Which of the following best explains their situation? A, low social class. B, low SES. C, low cultural capital. D, absolute poverty. What do you think?
The answer here is C, low cultural capital. Their wealth indicates they have high SES, but that lack of familiarity with the language, the practices, the norms of the healthcare system in their new country,
Right.
that creates a barrier for them.
Even though they have the financial resources, they don't have the cultural knowledge to access the care they need.
Exactly.
All right, so let's move on to social mobility. This is about how individuals move up or down in the social hierarchy.
Right. And there are different types of social mobility that sociologists talk about. One is vertical mobility, and that's moving up or down the social class ladder. So if someone grows up working class and becomes a doctor, that would be upward vertical mobility. And if someone loses their job and experiences a significant drop in income and status, that's downward vertical mobility.
Okay, what about horizontal mobility?
Horizontal mobility is like a side-to-side movement. It's when someone changes their job or career, but they stay within the same general social class level.
So like their income, their prestige, their social standing, those things stay pretty much the same.
Right. So, for example, someone might move from being a high school teacher to being a librarian. Those jobs are usually seen as being on a similar level socioeconomically.
Got it. Now, I know there are also these terms, intergenerational and intergenerational mobility. Those sound like they have something to do with time, right?
They do. Intergenerational mobility is about comparing the social status of different generations within a family. So we're asking, are the children better off than their parents were, or are they worse off?
Okay.
And intergenerational mobility looks at changes in a person's social status over the course of their lifetime. So someone might start out in a low-paying entry-level job and then work their way up to a much higher position.
So it's like looking at those individual trajectories, those upward or downward movements within a single person's career.
Right.
Okay, let's broaden our view a bit and talk about global inequality. This is something that's becoming more and more relevant for doctors, right?
Yeah, it really is. Global inequality refers to those massive differences in wealth, resources, health, and well-being that exist between countries around the world.
And as future doctors, you guys are going to be interacting with patients from all kinds of backgrounds. Some of you might be involved in global health initiatives, or you might even do humanitarian work abroad.
Right. So understanding global inequality and those social determinants of health that are at play in different parts of the world, it just gives you a much broader context for your work.
Okay, and what about this idea of the socioeconomic gradient in health? This is another important concept, right?
Definitely. This is a well-established pattern that basically shows that as a person's socioeconomic status increases, their health outcomes also tend to improve.
So wealthier people tend to be healthier.
On average, yes. And this holds true across many different societies and for a wide range of health conditions.
Okay, so why is that? What are some of the factors that contribute to this gradient?
Well, there's probably a lot of things at play, but some of the big ones are people with higher SES. They often have better access to nutritious food. They live and work in safer environments. They tend to have less exposure to chronic stress, and they have better access to healthcare services, of course.
Right, that makes sense. But it's also about more than just those material resources, right?
Yeah, absolutely. Things like health literacy, health behaviors, social support networks, all of these can be influenced by socioeconomic circumstances. And taken together, they contribute to this pattern where individuals with higher SES tend to live longer, healthier lives. For example, we see that chronic financial strain, which is much more common among lower SES groups, it can actually lead to prolonged activation of the body's stress response.
Whoa.
And that increases the risk of heart disease and other problems.
So it's like a biological link between socioeconomic disadvantage and poorer health.
Exactly.
Okay, let's wrap up by talking about the people who are most marginalized, those who experience poverty, social exclusion, and isolation. First of all, I think it's important to distinguish between different types of poverty, right?
Right. We often talk about absolute poverty, and that refers to a really severe lack of basic necessities. Things like food, shelter, clean water, healthcare. It's a life-threatening situation.
And then there's relative poverty, which is like being poor compared to the standards of your society.
Exactly. It's about being poor relative to the majority of people in your community. So even if your basic needs are met, you still lack access to the resources and opportunities that are considered normal or necessary in that society.
Like being able to afford a car or internet access or, those kinds of things that many people take for granted.
Right. In a developed country today, lacking reliable internet access could be considered a form of relative poverty because it can really limit your opportunities in education, employment, even social participation.
Okay, so that distinction is important. Now, what exactly do we mean by social exclusion?
Social exclusion is this process where marginalized individuals or groups are systematically prevented from fully participating in society.
So they're cut off from opportunities, they're denied resources, that kind of thing.
Exactly. And it can take different forms. It can lead to segregation, which is that physical separation where you have communities that are literally cut off from the rest of society. And it can also result in social and psychological isolation where people just feel disconnected, like they don't belong, they don't have meaningful social connections.
Wow. So social exclusion, it's about more than just a lack of money. It's about this much broader sense of marginalization and detachment from the social fabric.
Exactly.
Yeah.
And it can have a big impact on both mental and physical health.
Hmm.
Because it can lead to increased stress, it can make it harder to adopt healthy behaviors, and it can cut people off from support systems.
All right, this has been a super informative overview. Let's just recap some of the key takeaways for all of you future MCAT test takers out there.
Sure. So remember that difference between social class, which is like that broad social categorization, and SES, which is that more measurable, quantifiable factor based on income, education, and occupation. Make sure you understand those roles of cultural capital and social capital in social mobility, and how social reproduction can perpetuate inequality across generations, and really get a grasp on how power dynamics, privilege, and intersectionality affect access to healthcare and the quality of care people receive.
Yeah, those are huge.
And you also want to know the different types of social mobility: vertical, horizontal, intergenerational, and intergenerational. And be clear on those distinctions between absolute and relative poverty, the concept of social exclusion, and of course that socioeconomic gradient in health that we talked about.
Absolutely. And I think the main takeaway here for all of you future doctors is that this isn't just about memorizing terms for the MCAT. This is about developing a deeper understanding of how social forces really impact your patients' lives, their health, their beliefs, their access to care, everything. This understanding is going to be so crucial for providing equitable and effective care to everyone.
It's about seeing each patient as an individual, but also seeing them within that bigger social context, understanding all the factors that might be affecting their health and well-being.
Exactly. So as you continue on this journey to becoming a doctor, I want you to really ask yourselves, how might your own social background, your upbringing, your experiences, how might that shape your interactions with patients from different walks of life? And what can you actively do to make sure you're providing truly equitable and culturally competent care to every single person you encounter?
It's a question worth pondering, for sure.
It really is. Thanks so much for sharing your insights with us today. It's been really enlightening.
It was my pleasure.
And to all our listeners out there, thanks for tuning in to The Deep Dive. Until next time, keep learning, keep questioning, and keep striving for that deeper understanding of the world.